From a visual standpoint, people think like, oh, you should kind of look straight. Like, so if you just squeeze the shoulders back, sure, that'll make the spine straight, but the spine isn't fucking straight. That's the problem.
The breath has a impact on just about every bone in our body. Most people do not exhale fully. They are very good at inhaling, which is where kind of a lot of these pain syndromes that we run into stem from hyperinflation of the lungs.
If my shoulders are down, what's going to happen with my rib cage is going to push forward. It's going to roll forward. My scapula is going to anteriorly tip, which is going to make those traps appear to be huge. But it's really the ribs that are pushing the traps in that position that makes them appear like, oh my God, you got really big traps. It's like, yeah, but my grandma's 85. I don't think she's worked on traps before. And she's like this.
Right.
You know, so.
I've been working with you guys for maybe the past 3 years, and it's been cool to see different aspects of how we deal with posture. And I've seen different ways that I was taught that you guys know and do and practice. So it's really interesting. It's very awesome for me to see, you could do this for this type of posture. You could do that. And it's like, no, don't do that. So it's very eye-opening for myself to see different ways of doing it. Now, I kind of just want to start right away with if people barely just, clicked on this and can get some tips right away. Let's just go one by one of kind of debunking old posture myths. The first one I wanted to debunk was the shoulders back and down. I see that on TikTok everywhere. Why is shoulders back and down not, appropriate?
Sure. I'll take this one. Thank you, Nick. Well, first of all, we have to be able to move freely throughout our life, right? So the two things we need to do is move forward and breathe, right? So when you have someone to give you a short answer, and then we can go down a wormhole here, when you lock the shoulders back, from a visual standpoint, people think like, oh, you should kind of look straight, like a straight line. But one of the biggest misconceptions is that the spine is not a straight line. I mean, literally, if you open every single anatomy book there is, spine's curved. So if you just squeeze the shoulders back, sure, that'll make the spine straight, but the spine isn't fucking straight. That's the problem. And that will just lock them up, lock their movement up, their breathing pattern, etc. It's just not a good postural fix at all. And it'll create a lot of problems. And we could talk about those problems. Maybe Nick, you could come in here.
Yeah, I think Dave gave us some good examples. I think one big one that you will see is when you squeeze your shoulder blades back and you pull them down, when we start thinking of even just shoulder motion, right? Shoulder motion out in front of us, shoulder motion up top above our head requires our shoulder blade to actually pull away from our spine in terms of reaching horizontally. Now, if we start talking about motion up, vertical pressing, whichever kind of example you want to give, there is a upward rotation that's involved with it, right? So again, pulling away from the spine, rolling on the backside of the ribs to get your arm up overhead. Now, when your shoulder blade is constantly pulled back towards your spine and packed down, you're essentially doing the opposite, which would be pulling you further away from that. So what you'll end up seeing in short is, Dave kind of alluded to it, you're just throwing your rib cage forward, but then two, you're going to start restricting your motion at your shoulder. You're going to start initiating pushing your head forward. And one thing that most people don't realize is when you create a very flat thoracic spine, you're going to start restricting thoracic rotation mobility as well.
Now, it's so funny that you mentioned the spine is curved. Yeah. So then we have this idea the spine should be fucking straight. I remember watching this, it was literally a TikTok video where this guy's like, look how fucked up this spine is. And it's like an anatomical view from the side. And then you straighten your spine like this, and it's a posterior version where it's completely straight. So it's like, bro, you just use two different fucking anatomical positions. But anyways, so how about, what's the difference between having an excessive thoracic curve versus the ribs being like, because with your guys's, what I've learned from you is like the ribs are very malleable, yeah, and they're meant to breathe in and create expansion in through the rib cage. So if we squeeze the shoulder blades back, we get flattening of the ribs themselves, correct?
Yes. So the ribs are very malleable, absolutely. And when you do compress the compartment, the posterior compartment of the ribs, which is actually the biggest compartment of the ribs, is the
back end
posterior rib
bigger.
cage has the most space for your lungs to expand.
Okay.
So when you're squeezing those shoulders back, where's air gonna go?
Front.
Usually in the front, and that's why you see people with these rib tits. Actually, I have some right here because of all the years of rows and all the compressive shit that I've did.
And that's that's when we talk about like the handles right
here.
You see
a person with a huge rib flare, that's going to indicate posterior rib compression.
Gotcha.
Okay, they'll have why the front of the ribs? Well, they don't attach to anything, right? Like ribs 1 to 8, for example, attached to your sternum. Maybe I'm mistaken. Maybe it's 1 to 9. Not sure. But the floating, 1 to 8. Oh, yeah. Thanks, Nick.
Like
shit. My memory is pretty bad. Goldfish standard here. But they don't attach to anything. The floating ribs,
right.
So they just really have the tendency to expand a lot.
Got it.
Nick, what do you think, man?
I think you did a pretty good explanation of that. I think one other thing that you will see with a very flared rib cage forward is people will start to push their stomachs forward. So a lot of times there's a lot of other things that can tie into this. Obviously, you can tell if someone's got inflammation in their stomach, but it'll just look like they're pushing their stomach forward, which again, their gut will start going in this horizontal direction as opposed to kind of being more filled in across.
And is that because they're pushing back here?
Yeah.
So weight is starting to shift forward.
They're just pushing their center of mass forward, essentially. That's what happens. And then
from the squeezing of the shoulder blades back.
Yeah, I mean, depending on how deep we want to go with this, a lot of times when we are actually squeezing our shoulder blades back, we're just extending through this lower portion of our lumbar spine.
Got it.
And again, we tend to forget, but the rib cage wraps all the way around and connects to the spine, right? So if we're just emphasizing this, it's really going to show up down low too.
And then what do we get from that? Like what starts to happen in that area?
What will start to happen is you will start to you will significantly restrict mobility through your hips.
From squeezing the shoulder blades back, you'll restrict the hips?
Yes, absolutely.
How is that?
Because again, if we think of, generally speaking, in like an anatomy book, they'll tell you that your center of mass is kind of like in this S1, S2 region, somewhere down kind of belly button line.
Yeah.
Okay. Now, gravity is constantly trying to push us down towards the ground. So a lot of this can be, sometimes people just kind of overcorrect to get them to stand up straight. But again, what they're doing is they're just pushing their center forward. So if we were looking side by side in the camera, I'm going to exaggerate so it's easy to see. If I'm just orienting and pushing myself forward, what just happened from this straight line to then down here?
Yeah, you're getting a push through the hips.
Right?
Yeah.
So depending on how in-depth someone's assessment is, right, you can pick up on a lot of these things. You could pick up on, based off of their rib cage position, hey, what are we going to expect to see at their shoulders, at their hips, etc.?
Yeah. So if a person hears like the advice of like, all right, let me squeeze my shoulder blades back, down, it could potentially lead to some extension right up in the lower part of the spine, pushing the hips further forward. And is that when the pelvis itself starts to gently and slowly start to compress on the back end? Is that what tends to happen with that?
Go ahead. We're like trying to decide who you want to take this one from here.
It's going to be tough to demo and talk at the same time.
Okay, so you want to demo it and I'll talk? Batman and Robin this shit?
Okay, let's see.
All right, thanks for
Look
letting
at
me
this fucking
be
teamwork together.
Batman.
Finally, look at this.
Yeah,
teamwork.
yeah. So actually what's going to happen when the hip pushes forward, it's going to what we call orient. It's not going to really move at all. It's just going to it's not going to change shape at all. It's just going to the whole thing's going to move. The whole thing's just going to dump forward. And then what that's going to do is it's going to decrease, as Nick said earlier, your mobility just from squeezing your shoulders back, because you're turning on the erectors, and the erectors have the ability to push this forward.
So one thing to add here is if you look at the sacrum here, we're going to say that this is S1, and then if the spine stays stacked on top of it, it would have to go. Have to go back, 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 which would create this excessive arch and compression through the lower part of the lumbar, through the first part of the S vertebral bodies.
Got it.
Which will cause just a lot of compression again, which is just going to push the pelvis forward. Further forward. Yeah.
Okay, and then what? Obviously, disc herniations typically happen when there's more of flexion rather than extension. So we're not too worried about disc herniations in that regard, or what's the big thing from squeezing the shoulder blades? That extension at that lower part of the spine.
Well,
is it potentially disc bulges, or what's the potential?
So think of it this way: if the hip is gonna keep pushing forward, at some point, it's gonna have to pull back because your center of mass gone too far forward. So your body will find a strategy to dump this hip underneath you, and then now you're in this
to pull
you back because you're so far forward now. It'll find a strategy to bring your hip underneath you, and then you're in this posterior pelvic tilt,
and then
spinal.
That's now the flexion at the low back.
Yeah, well, hernias can happen that way, and it can also happen. It can happen multiple ways, but also a lack of hip movement.
Yeah.
If you don't have movement at the hip, you're gonna have to borrow movement through other places. Right. And a lot of the times we borrow movement through the spine because we can't move through the hip properly.
Gotcha. Go for it.
Oftentimes that's due to limited internal rotation too. Most people are limited in internal rotation. And I guess, again, just for a visual for your listeners to see, a lot of times when you see this, it'll look like this kind of deal, where if you're viewing them from the side and you can kind of see this clear indention or crease, that means that they are orienting or moving through that space more frequently. So whether it's, I'm moving my hip, but in all actuality, if you just see them moving through that, it's really just coming from their lumbar spine. Because again, that hip pushed forward motion.
And does that hip also, like, let's say the hips are moving forward. I just pull my shoulders back and down. I get some extension. My hips travel forward now. They're starting to tuck. Isn't that creating the femurs to externally rotate as well?
Yeah. Well, this is really what we're trying to find through the hip is more of an internal rotation. So we're trying to find more internal rotation, like because we're trying to compensate for that. So as the hip dumps forward, we're looking for internal rotation. But then at some point, your femurs are unable to internally rotate anymore. So as they keep pushing forward and posteriorly tilt, they're going to externally rotate.
Yes. So think of it this way: if you or your listeners are coming with like a classic sway back posture, kind of what I just showed, but it kind of has this dumped and you kind of just sit down in it, that's going to put someone in more of an ER bias through their femurs.
Got it. And then after that, hip is in a more of a extremely rotated bias. Then the knee, it'll affect the knees. They'll start to come in to compensate for the lack of internal rotation at the hip.
Yes.
And then the ankles and so on and so forth.
That's typically where you will see that hyperextension knee, because they don't have true hip extension. So when they don't have true hip extension, you're going to start seeing the knee go into a hyperextension.
Gotcha.
Because that's what they're missing up top. So they're just making up for it down low. One other thing to add in, though, is oftentimes where you see a lot of this anterior tilt of the pelvis, right? So your classic kind of like cheerleader pose or significant arch through the lower back.
Yeah.
Oftentimes people will move through that to generate internal rotation if they don't have true hip internal rotation.
Wow.
So, Dave, hold this. So what will end up happening is typically we got a femur that sits right here, right? And how that sits within the socket, you are going to get natural motion that rolls in. You're going to see this in more of an application setting when the foot strikes the ground and you're traveling over that foot, it will start to roll, 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 roll. What will happen instead is if someone's lacking that, this will be their compensation to roll over that femur to generate internal rotation.
Damn. Okay. And all that could possibly happen from squeezing your shoulder blades back and down?
Now, again, I don't want to I don't want to say that is like a direct correlation where, hey, you squeeze your shoulder blades back and down, that immediately is going to happen.
That's a lot, right? It's a lot of steps,
but
right?
Yeah, there's a lot of layering to it. And I think the big thing that we're discussing is what most people don't understand is when they start creating tension in a certain place up top, it's going to have this global effect throughout the body, even though they're just feeling that tension up top. Because the body is really like a tensegrity structure where you can do something up at your shoulder or you could do something up at your foot that could potentially have an impact on the opposite. So I think what the message we're trying to convey is even these small little things up top, what you think you're doing, it's likely you're not truly doing that. You're doing something else that then has the impact on other areas of your body.
Gotcha. Wow. Well, what should people do instead?
Oftentimes, it seems so silly because it's like when I start organizing people into a better position, a good starting point that I will tell people is I will have them kind of like stand side by side in a mirror. I'll have them get a little bend in the knees just so they're more aware of this kind of thing with their hips and their pelvis. I'll have them kind of maintain a tall vertical spine as they reach forward to pull the shoulder blades away from them. And as they can get into a relaxed position and feel just light ab sensation with that reach, drop that arm down. That's likely where you should be.
Oh.
Yeah. Because again, it's just posture is really about stacking your bones in the right positions. The closer we can get to a stack of head on top of rib cage on top of pelvis, the rest will do. The rest will kind of fix itself for the most part. There's small, little nuance within it. But I think for the most part, the more people can organize this on top of the pelvis, they're going to be in good shape. They're going to be far better off than what they started with by trying to create tension, or the other big one is squeezing their ass because glutes.
That's another one I wanted to hit was the butt squeezing.
I got to remind myself I'm actually squeezing my ass right now. I think it's because I'm a little nervous.
There are no bars of soap here, so we don't have to squeeze them.
He relaxes. You just hear the bar soap drop.
I'll let out a fart.
Although yesterday I tried squeezing a watermelon with my inner thighs just to see what would happen. No, I'm not strong enough.
I could imagine.
Yeah, just like test it, sir. This watermelon ain't good. I don't want it.
You just go to the grocery store. This is how I test them.
Yeah.
Well, why shouldn't people squeeze their ass then?
Really for the same reasons as the shoulder, but now it's like more in direction to the pelvis, because remember we talked about that sway back posture?
Yeah.
So we talked about that sway back posture with the hip going underneath. So really what the glutes are doing when the hip goes underneath is preventing you from falling further forward. So they're acting like brakes to stop that from happening. Now the glutes insert here on the back from the sacrum to the ilium onto the femur. Okay? And what's going to happen as they contract, they're going to do this to the glute.
Right.
I'm sorry, this to the pelvis, my bad.
Yeah.
And what ends up happening, now you have externally rotated femurs, and you have that lumbar flexion as well, and that's what your glutes are going to do. And if your glutes are in a completely contracted position and shortened position, you can't use them. Because the way you use a muscle is you have to load the muscle by lengthening it first,
Yes.
and then you can produce force.
Yes.
So squeezing your glutes is probably the worst thing you can do for your glutes,
Yes.
also for your hip and for your lower back.
Yeah. Now, this is something I've noticed about people working with them. Like, if they have a descended abdomen, what I've noticed is they kind of contract their glutes to stabilize their low back because the descended abdomen isn't creating enough tension to support the lumbar spine. So I've seen people just, and they'll have to squeeze, and they're like, oh, I feel more sturdy now. That's tight back there. Spine's not wiggling too much, and they kind of have this kind of walk. And then also the people that squeeze their glutes all the time, a big realization for me was that I was like, oh, they're really strong. But it wasn't, they're not very strong. They're very just tight. And they're not strong because they haven't been able to fully stretch and fully contract. So they weren't actually getting enough strength in their glutes. So they have these really tight, small asses.
Correct.
Yeah, I think something to touch up on here is people tend to forget that muscles are just influenced by joint positions. Mm-hmm. Therefore, if the joint is stuck in a particular position, in this case, what we just alluded to here is push forward where you have shortened glutes, you're not going to get the lengthened aspects out of those things. And a lot of times when we live in a world of gravity, most of our muscle actions are from lengthening, right? Lengthening to then get out and have a shortening component. Now, when you're in the gym and you're in the weight room, it's a little bit of a different story, right? Anytime you're pushing away from the ground, you're likely shortening your muscles. Anytime you're controlling yourself down towards the ground, you're lengthening your muscles. And I think it's important to differentiate between concentric orientation or shortening of muscle fibers and eccentric orientation or lengthening of muscle fibers. Because I think, in your upper cross syndrome, lower cross syndrome, there would always be an association of, hey, a muscle is short, that means that it's strong.
Right.
Or a muscle is long, that means that it's weak.
Correct.
That's not necessarily the case.
Yeah.
I think people that move really well have the capabilities of having joints in really good positions that allow for them to move into something and then out of something just like that. Okay. And, it's all about being able to control that center of mass in a bunch of different directions. And the more you could do that, you typically have someone who's probably going to significantly reduce their risk of injury.
Yeah. And then the reason for, the posture, because I learned lower cross syndrome, upper cross syndrome. This one's tight and long and weak, or short and strong. The reason, again, for that, just to clarify, is because they're for tight ones, is their inability to get that full range of motion through that joint.
Yes, oftentimes joints will get kind of sticky in a particular position.
Gotcha.
And again, when we take even one step further, it's their center of mass isn't moving side to side.
Yeah.
Where when we start even thinking about walking, there should be this weight distribution on one side to the other. It goes back and forth. Oftentimes what will happen is people will become lateralized in their pelvis.
Yeah.
So they'll be significantly shifted onto one side where they don't move into that other side, which then just creates imbalances, over time.
Gotcha. Cool. Good with that one, David?
Yeah, I wish Nick was my teacher in high school. I would have never skipped class.
Yeah,
you make it seem. It's awesome. No, that was a great explanation. I would not add anything to that.
Perfect. Here's another postural myth that was very interesting for me to learn is the traps, right? The traps are overactive. These guys are like the cause of all my pain. I want to stretch these motherfucker out. Look how big my traps are. And that was a big one for me to be like, oh, whoa, the traps are actually not strong at all. They're not holding their responsibility in shoulder flexion at all. And that's potentially the cause of their pain. Too long of traps that display, hypertrophy.
I'm going to let Dave take this one, but before I let him take this one, it looks like you haven't hit traps since about middle school.
Oh, shut the fuck up. I've been hitting it. Does it look that way? Now I feel insecure, you motherfucker. You son of a bitch.
Wear a jacket, put some socks underneath the jacket. You'll be fine. No, well, okay, so there was a few points with this one.
Okay, talk about
So the trap, we were talking earlier about shoulders back and down. The
Yes.
trap is a really important upward rotator of the scapula.
Yeah.
So when you flex your arm, your scapula should upwardly rotate, okay? And if you squeeze shoulders down, you're inhibiting the trap right away. So you cannot upwardly rotate and use the trap to get your arm overhead.
Yes.
Another thing, the trap's function is to oppose the forces of gravity through your shoulder blade and your shoulder as well.
Mm-hmm.
So if gravity's just kicking your ass all day and your shoulders are sunk down, your trap's not at a advantage there. So what's going to happen, your muscle's just going to atrophy. The traps will atrophy and they'll become really painful. And then people will say like, oh, my traps are involved in everything I do, even in a row. But that's because the trap has such a low work capacity at that point.
It's burning.
Any kind of stimulus will just not activate it, but it'll fatigue it right away. So the trap has such a low work capacity at that point. They're like, oh, I feel my traps when I'm doing a calf raise. It's like, yeah, because your traps suck, So,
and they've been like very much so demonized, right? Like the
Yes.
traps are just like, oh, I got.
yeah, we've had like people, come in and they're like, oh, my masseuse stuck their heel in my trap, thinking that that'll make it better. It's like an elbow and using all these devices to get it released, and for years, and they don't get any kind of sense of a relief or pain at all. It's so really also to answer another question, you said the traps appear to be these like big slabs of muscle on a lot of individuals.
Yep.
So what happens is if my shoulders are down, what's going to happen with my rib cage is going to push forward. It's going to roll forward. My scapula is going to anteriorly tip, which is going to make those traps appear to be huge. But it's really the ribs that are pushing the traps in that position that makes them appear like, oh my God, you got really big traps. It's like, yeah, but my grandma's 85. I don't think she's worked on traps before. And she's like this.
Right.
So.
Which is a very like interesting common misconception, because then they look big. You're working out, you feel them like tense up. And you're like, fuck, they're tensed up. They look big, tense, big. That's 1 + 2, and they're overworking.
Yeah.
So it's a very good misconception. I'm just gonna restart this one real quick. Bam.
Thanks for the time, Nick.
Yeah, I feel like a lot of times too, clients, patients that I see, they need that like validation of, oh, just go and touch this right here. Doesn't that feel tight? And usually it's the superior border of their scapula, which is a bone. So of course it's gonna feel.
Oh shit, that's hilarious.
It's gonna feel very stiff, and it's like, hey, yeah, don't you feel that? I'm like, yeah, that's a bone. That's supposed to be hard.
Yeah.
That's
hilarious.
But Dave hit it right on the head. I think the one thing to add into it, which, by the way, if you haven't seen this guy's presentation on the neck, it's a very good one.
Yeah,
The upper trap is also a rotator of the neck, right? So if we are rotating to the right side, for example, this area should be lengthening. Now, what ends up happening is if you have a right shoulder that's significantly lower than the opposite, making, again, more of an eccentric orientation of that right upper trap, and you're rotating that head and you're like, you know what? I'm feeling a lot of pain on this right side. It's due to the imbalance or the overstretching of that right side upper trap. Does that make sense?
Yeah.
So that's another big one aside from just the shoulder and the shoulder function.
Yeah, I wanted to give, that's so true, by the way, like my God, you see the neck rotation. Literally, if you put their shoulder in upwards rotation and then tell them to rotate their head, you'll see significant improvement in their head rotation instantly. Like
Pretty quickly.
Like 1 second. And another like quick assessment that you can do, you tell a person, relax your shoulders. They're relaxed. Yeah, but they're maximally depressed and in downward rotation. So it's like, okay, how's that an upper trap problem again? How are they overactive?
If they're in a long position.
Yeah, tell anybody. They walk in, they walk in. I'm like, okay, relax your shoulders. Like, I'm relaxed. It's like, yeah. Then you don't see any movement there because they're completely depressed down and in that downward rotation.
So that means there's no tension there to begin with. So what the fuck you're talking about tension?
The tension is coming, as Nick was saying, through an eccentric tension, which is too lengthened of a position.
Yeah.
Of that muscle.
So then we go back to muscles just follow the role of where the joints are. If we start looking at the scapulothoracic joint, which this is a big part of, if we set that in a better position, which will affect the shoulder, it'll have an impact on the neck, we're going to start getting a lot more out of that tissue because it won't be stuck on that lengthened end of the spectrum.
Okay.
One other thing that's kind of like an added bonus to this too that you'll typically see is if people, this is a good little diagnostic, if people are having like numbness, tingling associated with neck pain down the arm, right? When we start thinking of your brachial plexus, which is, again, just a fancy term for a bundle of nerves that travels from the neck down deep to the clavicle here through the shoulder and down to the arm. If that shoulder is significantly depressed, which is reducing the space kind of in this area here of your acromion and where that travels, you will very frequently see some compression of the nerves, which will send signals down that right side.
Damn.
Yep.
Yeah.
Because that collarbone moves with the scapula. And if the scapula is moving down, it'll drag that collarbone down with it. And as Nick said, if you look at the anatomy of the brachial plexus, which is a bundle of nerves, you'll see that collarbone and the brachial plexus runs right underneath the collarbone. So if you're bringing the collarbone lower and lower and lower, it's going to crush the brachial plexus.
Reduce the space, which will then feed into just compression, that nerve,
Yeah, and this one, I like this one because you can look right in the mirror and see if your clavicles are straight, then you have depression there. They should always be just slightly above, right? Like, what's the angle there? Maybe like 30, 20? What is?
Truthfully, it's going to vary depending on someone's
I've
structure.
seen some guys like really beautiful. I kind of like them when they're nice and high. They have like a nice, cool look. Mine are a little more flat, which is kind of lame, but I don't have pain, thank God.
Yeah, that's because you just need to work on your pecs a little bit more.
Could that affect my pec growth if my traps aren't properly?
I mean, I wouldn't go that far, but you just think of, again, if you're trying to build muscle is built in that eccentric or that lengthened phase. Mm-hmm. So, for example, if we're talking chest, how well can you manage your sternum position as you get a load where you're controlling this angle, right? Because if we're, again, going at chest has an attachment on your sternum, has an attachment, let's just say, kind of right in this area, front of the shoulder. The more and more I can maintain this position as I go back slowly, control that motion to then get back up to the top, as opposed to dipping this down, this isn't going to really get you pecs.
Gotcha.
This is going to get you pecs.
So I should walk around like this too?
I mean, if you want people to think that you work out because your normal stance is pretty...
I don't know. I like Miguel's physique. I think he would be a good UFC fighter.
Oh, dude, I would.
Like, he'd be quick and malleable and flexible.
Yeah, man, I wish we had like a squat rack right here just so we can show how high he puts the safety bars on back squat day.
I changed it up.
Okay.
I did change it up. Now, I do it for my safety.
Yeah, no, of course. Safety is number one, wherever it is. Bedroom, gym, workspace.
Yeah, so you guys
use condoms.
Get vaccinated as well for your safety, guys. Okay?
Yeah.
We all need to get vaccinated.
Yep. With all vaccines that are necessary.
I got all the boosters too, because if you get 12 boosters, then you get
Happy Meal?
a free Happy Meal.
Dude, what?
It's a toy of Fauci. It's a toy, yeah.
Dude, you guys need to see the Joe Rogan with, what's the name? Terrence Howard. It's fucking great. They go into the vaccine too. It's great. I love that. Anyways, let's get back to posture real quick.
Yes.
Another one that I'm still a little confused on is breathing properly, right? So I think very, very, very early on, I was learning really low diaphragmatic breathing. And then I went to the Czech Institute. They teach a 3-part breathing. They want the diaphragm to drop a little bit. Then you get into the upper and middle and then upper chest. So then that one was like, all right, cool. So a little bit of diaphragmatic or dropping down in the diaphragm into the belly, middle, and the last little part will be the upper here. And that's kind of where I'm at in my education. What do you guys feel about and think about the breathing and understand?
Breathing is super important. The breath has a impact on just about every bone in our body. It might not be easy to see that at a surface level, but when we start thinking of our diaphragm and its relationship with our rib cage, well, our rib cage attaches up at shoulder blades, shoulders, also down at our pelvis. So even just taking a good inhale, a good exhale, you're going to impact potentially all of these motions that occur. Now, taking a step further into it, inhale is usually paired with more motions revolving external rotation.
Right.
Okay. So when you take a nice inhale, it kind of stems right here at the base of the ribs where your diaphragm sits, right? And as you inhale, your diaphragm comes down. And then as you exhale, it kind of parachutes up.
Right.
Okay. Now, one thing that you will commonly see with this is most people do not exhale fully. They are very good at inhaling, which is where kind of a lot of these pain syndromes that we run into stem from hyperinflation of the lungs, which is, again...
That's so crazy to think that there's people that have hyperinflation. Because you always think, or at least hear, like I guess it's a big buzzwords of like, take deep breaths. But you're the first person actually to tell me like, hey, like these people need to fucking exhale fully too. Which is, the same side of the other side of the coin.
Yeah, it all attaches like to this whole conversation. We talked about posterior compression, rib flare. When the ribs are flared out like this, the ribs are externally rotated in the front. So when you go ahead and you exhale and let all the air out, you're internally rotating the front of your ribs and trying to get in a better position to take a slow inhale. Hopefully you could get some posterior expansion. So you want the back of the ribs to externally rotate and the front of the ribs to internally rotate.
Whoa, they happen at the same time?
No.
I mean, at the same time, but they do the opposite motion?
So really, yeah. So
Say
really
that again, I'm so sorry.
No worries.
Okay,
so when you have a rib flare, someone
flare.
with a popped up rib this, they're externally rotated.
Sure, okay.
These ribs. So the only way to get them down is through exhaling. Because a lot of people will do this kind of shit, but you're not really changing shape at your ribs. You're just changing
the spine.
Yeah, you're just flexing your spine and doing all weird shit. So what you need to do is fully exhale. That's going to internally rotate the ribs. It's going to close that angle. Then where does air have to go if that angle's closed?
Up.
It's going to usually go in areas of compression. So think of it this: if when you get a dent in your car, don't they use like that? Have you ever seen that suction?
Yes, I have one. Yeah.
So that's really what you're doing with your breath. So when you close this space and you have a ton of compression here and then inhale, air is going to have to travel into the back of your ribs to open that up.
Okay.
That's why the exhale is so important. So that's why belly breathing is another horse shit technique. Sorry for all the yogis out there, but it's really bad because of that.
Gotcha.
Because you're just... Now, it can work. Belly breathing can work for someone that has a ton of compression in the front. Yes, people that typically clench like that.
Gotcha.
Belly breathing would be very good for those people. But you need to assess them. So you can't assume belly breathing is good for the masses, Right. It's an individual. Each person has their own compensations.
Yeah. Now let's take a person that does have externally rotated ribs.
Mm-hmm.
Are you saying that if they place them back into a neutral position where it should be, hold them there and breathe in,
Yep.
then they'll get air in the proper space.
Correct. If they
Okay,
can
understood.
control that rib position, the new rib position. So it's like exhale, keep the ribs in that position as you find a gentle inhale through the nose.
And then when you coach people, do you coach them to hold?
I tell them to really, it's complicated because if you tell them to hold, they're just going to sometimes squeeze the shit out of their abs. Really just have them fully exhale first and get them to feel what that's like and where their ribs are, what position their ribs are after a full inhale. A full exhale. And most people can't fully exhale well.
Oh, really?
No, they're bad at it.
Really quick, I typically will have someone pause for a 2 count, maybe even a 3 count, depending on how good they are.
Yeah.
Because just like with muscles, eccentric orientation, concentric orientation, when you get them to pause and find that position, their diaphragm is not going through a change in either direction. You're kind of holding that ISO, which will build up the capacity, if you will, of that diaphragm. Because again, diaphragm is really just like an air pump, if you will, right? And it's just like a muscle that we would train in a gym, right? We tend to just bypass it because it's slow, it's boring, it's not sexy. But when we start talking about global function and being able to, get air in freely and efficiently, it's a pretty important thing that I think most people should, spend a little bit of time throughout their training weeks just doing a little bit of stuff there, because they will see some sort of impact from it in a positive way.
Yep. And keep in mind the diaphragm, if you want to relax the diaphragm, keep in mind inhaling actually contracts the diaphragm.
Inhaling contracts the
diaphragm. It contracts it. It's exhaling that, quote, relaxes the diaphragm. Eccentric diaphragm is exhaling. Concentric diaphragm is inhaling, excuse me.
Oh, so it's the internal obliques and internal and external obliques that are creating the compression?
Correct. Internal obliques, transverse abdominis, and external obliques that are creating compression in the ribs to close them down, and the diaphragm is actually relaxing, and it's descending, I believe. I always get mixed up, honestly, but with exhale, it descends, right? Creating.
Yeah, no. When you inhale, it descends.
When you inhale, it descends. When you exhale, it comes up.
Okay, I thought as you inhale, it will create space for your guts and all your organs. That's why it ascends when you inhale, and then as you exhale, descending. I'm always confused about that.
Yeah, I mean,
it's all good.
Right, we're the experts.
It's all good. It's all good.
One important thing though too, talking about the diaphragm, is when it stays in that kind of inhalation, flared rib cage state, it's got a attachment point at T12, somewhere in that area, T12L1, which is kind of that TL junction. So that alone will reinforce that extension pattern, which again is just reinforcing that rib cage flare. So usually when you see someone super compressed on the backside of their body, if they're in varying degrees, increases in pain where they can barely move, getting them to fully exhale will actually give them the ability to get some movement in and feel like they're doing something without just reinforcing that extension pattern.
Gotcha. And is that what you do with your patients?
I try to get them up and move as much as I can. Most of the people that I see, I can find some things to kind of get them to feel some things early on. Really depends on where their activity level is. If there's someone who hasn't felt a sensation other than just negativity, pain, and that's all their mind's fixated on, I just got to get them to feel something and draw an association that that's not bad. That's actually good.
The pain?
No, a sensation other than pain.
Oh. Mm-hmm.
Because again, like some of the people that come in that have very low activity level, all they're doing is sitting in front of their TV watching CNN or Fox, all day long. Mm-hmm. And if you're not getting any movement at all you're going to start feeling are some of those negative effects of, you know what, my body hurts. Wow, what's this? So the moment you start giving them something novel with a low training age, they automatically associate that to something negative because they haven't felt anything else. So it's really building the confidence in them to say, hey, you know what? Our muscles are really sensory organs. The more and more I can get you to feel muscles, it's going to take a lot of stress off of those joints that you're feeling. And then the more and more I can slowly build your tolerance and your capacity up over time, now you're going to get more fit, you're going to get stronger, and it's going to reduce what you're coming in for.
Gotcha.
Yeah.
Nice, man. How about when folks do like the high, the high crown, you know what I mean? Like raising their head up. Is that another myth there? This long neck, long head?
Man, I was really hoping you were going to ask about the chin tuck.
Yeah.
Oh, is it the chin tuck or head up to the ceiling?
This here, this move here.
Oh, like yeah.
I worked at a physical therapy clinic where there was like the
hey, pretend like you're a puppet master and you're pulling the string as long as you can.
Yeah.
That one?
Yeah.
Yeah, I mean, hey.
I could tell the passion.
If you...
You're so passionate. What'd you work for before?
I've pretty much seen it all, pal.
Yeah.
And that's where, again, it's even those experiences at the time where you thought, oh, man, this is really good.
Yeah.
It helps you develop the skill sets. You're like, you know what? I've seen that. That doesn't really work. I think context is important. I think the world we live in today, we're trying to generalize and we're trying to dump people in certain categories. But the reality is if you have someone who is super compressed towards the ground, getting them to try to just lift and get tall might actually be beneficial, right? Someone who's already in that like military posture, barely moves, more or less side bends like this to get around, it's probably not going to do much for them. But I was really excited for the chin tuck because, again, back in the day, it's something that I was taught to do, and I think I did way early on in my career. And then you just realize that if it looks like dog shit and it smells like dog shit, it's probably dog shit. And a big issue with it is hey, at the end of the day, let me be clear. If you have someone do a chin tuck, they're comfortable with it and they feel better, by all means, give them chin tucks. But when you start to look at it from a more dense lens, what you do by just bringing this chin down, try to have them take a breath of air there.
Even his voice is changing because his airway's being blocked. He's closing his airway by shoving his head back.
Right. And I'm sure a few arteries and veins as well.
So they're very nasally, those people. I kind of sound like Eminem, you know? Mom spaghetti, you know?
Yeah.
Oh, really?
No, yeah.
You know, because
they're closing
as
their
I'm saying,
airway.
they're closing the airway, and I'll add on that they'll reduce. Also, a lot of them will reduce the curvature, as we talked about. The spine is not straight. Mm-hmm. They'll reduce the curvature in their neck, which typically they say we have a 30-degree curvature. It could be less, it could be more on some people, but usually it's 30 degrees, I guess. And that will reduce the curvature of the spine, the cervical spine, by shoving the head back. So that's also not a great deal. That'll lead to a lot of disc degeneration and stuff like that.
Okay, so chin tucks is a no-go either.
Definitely not.
Not even with the band, and then I add pressure and I tuck
with
against the resistance of the band.
No, not even like a BBW jumping on the band either. No.
I've never heard of
that. Yeah, I think a big talking point to kind of like summarize is a lot of the things that I learned in the rehab realm early on. I think the intention behind it was well, that it's not like people had this intention that they wanted to harm people or hurt people. Sure. I think that there was just a lack of knowledge of how this affects other areas of the body.
Yeah.
Because all of the things that we've touched up on today, they're all very trash.
And popular, like
Very
they're very
popular.
popular.
If you go on Instagram, you probably see a lot of glute training that involves just squeezing your ass.
Yeah.
But again, if we talked about with the chest and building chest, same thing goes for glutes. You want to build big glutes, load into the bottom portion of a squat and really control that bottom portion where you're essentially in a max depth eccentric orientation of that glute where you have weight that's challenging. That followed by pushing through the ground to stand up is what's going to get those glutes nice and juicy.
Yeah. Let's perfect. I love the glute conversation. Let's end with the one that is very popular that I've seen, which is the squat, and then the squat,
the air hump at the end.
the air hump at the end, the butt squeeze, the nutcracker, if you will.
Can we say dicks out for Harambe?
Yeah, absolutely.
Yep. By rest in peace. Life's never been the same since since Harambe died. So maybe a moment of silence.
There it
You
is.
can't laugh, Miguel.
Dude.
But yeah. Oh no. You.
I got
What
something.
were you gonna say other than Harambe?
I
like,
got something brief on this, and
Uh-huh.
then I'll let you take over. When we start thinking of the two big main lifts of the lower body, we've got hinging, we've got squatting. Squatting should be a vertical displacement of the hips or the pelvis, dropping straight down and coming straight up. Therefore, that finish position at the top shouldn't be pushing your hips forward.
Shouldn't be pushing.
Should not be. It should be pushing through the ground to come up. So that lower cake at the bottom, you're getting that up here where you're finishing in somewhat of an upright position. Now, if you're going into more of a hinge, right, horizontal displacement of your pelvis, as you push to stand back up, naturally you're going to be going forward, but it shouldn't be, again, dumping into it where you look like, you know.
an asshole.
Yeah.
We had to find a word. But yeah, that again also reinforces exactly what we talked about: glute compression and getting it fully in this shortened position. It's just gonna lock your hips up, right? Pushing the pelvis forward.
Yes.
Here, I literally, you got this from a grave site. So push. Right,
Pushing
it's
the
going to
pelvis
push it forward. It's going to turn the femurs
It's
out.
also gonna, yeah.
And you'll see a lot of people have, a lot of issues with the anterior sockets of the hip joints because their femurs are just shoved forward. So if you look at the acetabulum, which is the hip socket, a lot of times like on MRI, and I know like we can have a discussion about bullshit and MRI and stuff.
Yeah.
But MRI and X-rays, you'll see a lot of like arthritis. You'll see a lot of tears in the anterior portion, and it's because people are already in that forward position. So you don't want to reinforce that.
Got it.
So
no ass squeezing at the top of a squat. Well, at least if you want to be, functionally healthy. I think bodybuilders do it because they're trying to get as much glute contraction from every single exercise, but they walk disgustingly and they're very like, oh.
Yeah, they're just. I think they have a poor idea about biomechanics. I mean, they don't freak
care about
athletes. They don't care, right?
They don't care about biomechanics. There is
Exactly.
like, how big is it?
That's all. Yeah.
Right, and some of you girls that want to do butt workouts just care about how big it is, and I'm here for it.
I think there's.
I like it.
I think that there's an important piece to address here of when you put the bones in the right positions, the right muscles are going to fire. Yeah. That's just the way that the body works. Now, there's a difference between finishing and extension, and then there's a difference between finishing and hyperextension. And I think all we're trying to address here is finish an extension, finish with your hips through. Now, if that means that you're driving feet through the ground to get up to that top position, you should feel glutes.
Yeah,
but again, finishing in extension, boom, here is different than finishing in hyperextension here, which then just dumps into lumbar flexion.
Yeah, and that's what I see.
100%. Because at that last portion that Nick was demonstrating, you're not getting any more contraction actually through any muscles. You're just you're getting that spinal flexion. Everything's going underneath the rest of your body. Literally, you're like hinging backwards and dumping the hip forward. You're not getting any muscle activity whatsoever by doing that. Yes, think of it this way. If I'm trying to get hamstrings here, okay, right? I can get hamstrings by flexing my knee, right?
Yeah.
Or I can get hamstrings by arching my back like that, getting hamstrings. I can move my leg by arching my back as well. My heel's moving on both of them. But there's no change happening at my hamstring because I'm not able to flex my knee. What I'm doing is I'm dumping my pelvis forward. See that?
Yeah.
And that kind of moves me in that position. So there's no muscular activity happening at that end range where Nick said they're doing that hyperextension there. There's nothing happening there but putting load on your lumbar spine.
Interesting.
Yeah.
Cool. Is there anything else you guys would like to hit before we wrap here? Common posture faults and lies and misinformation?
I'd say there is one, yeah.
Oh.
A very common one.
Tell me.
Flat feet. That's a big one.
Let me just
And Nick likes that one. That's why, Nick, you could take this one from here.
This is a very good one.
It's a very juicy one. I thought about it when I was dreaming yesterday.
Oh my God.
I was like, Miguel invited me. So I was like, no, really. Everyone says they have flat feet. Nick,
Okay.
please do your thing.
Let's do it.
Yes, I'm glad you brought this up, Dave. Flat feet are absolutely a thing, and flat feet are not a death sentence. I am someone who has flat feet. I don't need an orthotic, nor am I dead.
Yeah.
And I think we live in a world where a lot of doctors, a lot of podiatrists are trained to just slap someone in an orthotic right away without getting that person to understand, how to use their feet and things that they should be feeling within their feet. Now,
I don't know what
I don't know what I did. So naturally, when we look at a flat foot presentation, what's going on here is this arch is just kind of like in contact with the ground. Now, this can have an impact on the shin bone, but I don't even think we need to go there. The more and more that people can actually use this area to then load into it, to then press out of it, that is going to actually give them a lot more direct connection through their hips. Now,
placing the midfoot or placing the what?
Basically, so I was trying to just demonstrate and show that a flat foot position is, if we're looking at this foot right here, right, you can kind of see how there's a normal arch, right in this kind of area. Now, during flat foot, you're going to this is going to be dumped like so.
Yeah.
And usually what happens is this tibial bone,
Yeah.
your shin bone, is going to follow. Okay?
Yeah.
Now, the common correction for this has been, you know what? You don't have anything going on within your body. Maybe your foot hurts. Maybe it doesn't. Let's put you in a high arch support, right? And let's not ever really teach you how to use your foot. Let's just put you in a high arch support, and then we're going to slap that thing in there. You're going to be in it for 20 years until the cows come home. The issue with this is people start relying on this foot placement within the shoe. Now, when we start thinking about just day-to-day mechanics, right, of walking, Dave, hold this real quick. Foot strikes the ground, right? And as this foot starts to come closer and closer to the ground, if we don't actually have this rotation motion coming down into the floor to absorb the ground, because there's an orthotic there, all we're going to be doing is bypassing that motion, but that motion's got to come from somewhere. So over time, what usually ends up happening is you start feeling knees, you start feeling hips, you start feeling lower backs, you name it. So I think the big gist of this is footwear can impact this, right? And long-term orthotic use. Over time, I've realized that I'm not against orthotics. I'm just against orthotics being slapped in a shoe irresponsibly without the intention or idea of lessening some of that support so they could actually start feeling their foot moving into that pronation as opposed to just staying in that high arched outside edge of the foot as they continue walking forward.
Yeah. And then, so just in layman's term, the orthotic that with the arch is keeping the foot at a high arch, not allowing the foot to go through a full range of motion, which is absolutely necessary to signal to the hip where to place itself. So then now they're just on the outside of the foot and their hips and knees are compensating.
Yeah, because again, how this operates is right when we're about to go toe off, we should see this kind of action happen. Where someone's coming right up over the ball of the foot to then propel them forward. What ends up happening is in a foot that's stuffed in an orthotic, you're going to just start biasing that foot position, like you said, towards that high arch, which is going to create a lot of lateral foot pressure. So now when they're coming up over the top for toe off during the walking cycle, they're not really getting big toe extension. They're just coming out over to the side, which is messing up things up the chain. Because big toe extension is very much necessary for hip extension.
Okay. Hell yeah.
Yep. And on top of that too, they won't be able to get flattening of the foot anymore. Like actually, they don't have flat feet. But here, let's let me demonstrate this. In order to produce force also in mid-phase of gait, your foot needs to also be able to spread like that.
Right.
So you can produce force.
Right,
now, if you have that orthotic, it's never going to happen.
Yeah.
So you can't get internal rotation at all.
Right,
if
at
you have
the
that,
foot.
Yeah, at the foot.
So it's robbing you
But
completely of a mechanic that you need.
Yeah, but at the foot, if you don't have internal rotation at the foot, you'll never be able to internally rotate at the hip and throughout the rest of the body.
Wow.
Just from the foot.
That's crazy.
So literally, we take people out of their orthotics and tell them to just walk around and have the whole session without the orthotics, and they usually feel you get a lot of good feedback from that.
Love that. Now the best shoes to be walking in, that's the Hoka, right?
Yeah, with the donuts inserted inside.
Like the bigger the cushion, the better for the person, right?
Negative. I knew you were gonna.
It's less-
I knew we were gonna get into this.
Yeah.
So basically, what my recommendations are for footwear is for someone to be able to feel good heel contact and be able to feel that ball of the foot, this area right in here.
So they can feel that through their shoe.
Yeah, through the shoe. Because
The
again,
Hokas are not going to work. They're cute.
yeah, what ends up happening is a lot of these shoes today, I kind of tell people we've got a spectrum of function versus fashion.
Yeah.
Right? And the fashion trend is starting to cover into the, fitness or activity shoes, which short and simple, if you have a shoe that makes it feel like you're walking on a cloud, you should probably get a new shoe. Context is important. If you are a big walker or a runner and you go long distances, scratch what I just said, throw it out the window. You can use a little bit more padded shoes like a Hoka for some of those longer distances. But for a day-to-day shoe, you should definitely be in something that's a little bit more towards the flatter side, so not as heavily padded, where you can feel good support in those areas that I mentioned, heel and ball of the foot. Anything to add, Dave?
No, not at all. 100%. It just, it'll rob you from producing force into the ground. So it's not more cushion for the pushing ain't happening in your foot, sir.
From what I learned too, we have very sensitive, or we have a lot of nerve endings right at the foot, so it sends a lot of signals to the body where to orient from the foot. So if the if, like for example, if you had big old gloves and you're trying to read Braille, you probably wouldn't get the proper words that you're trying to read if you're with the big old gloves, which you were not going to wear at the gym, Adam. Don't wear gloves at the gym.
Don't wear gloves, man.
So the Hoka is like these really thick gloves on your feet that are even more sensitive than your hands, so they're not going to tell your body where to properly orient it either, right?
That's such a good way of putting it.
Right?
Yeah, that was great.
You hit it right on the head, dude. That's a very important part that I didn't add in that people need to hear more of is we've got tons of nerve endings that give us that proprioception awareness.
Right. Yeah.
And if that is just being halted by something being snugged and heavily padded, you're not going to feel any of that.
Yeah, and that's why your feet are ticklish.
Well, I heard that ticklish in the feet is because they have inflammation there. I don't know.
Ooh, where'd
Dave-
you hear that from? It sounds very familiar.
A pretty well-known influencer in Los Angeles.
Oh, yeah, he is an influencer. You're right.
Yeah, we're just clowning people now. Okay, guys, where,
Yep.
where can they find you? You guys are great. Where can they learn more or maybe put them on as a client?
The Human Mechanic on Instagram.
The Human Mechanic.
You can follow us there. He's Nick, I'm David, and we're the Human Mechanic.
Yeah, we are in the process of launching our new brand. Anything rehab, performance, education involved. If you are a general pop client trying to get in shape, if you are someone in chronic pain who is trying to get out of that, or if you are a trainer, physical therapist, physical therapy student who is looking to get an edge on the competition as far as education goes, we can check those boxes too. So the Human Mechanic, I'm Nick, that is Dave.
Pleasure.
All right, guys, thank you. And that's it. Catch you on another one.
Thanks, Miguel.
Of course.
Thank you, brother.